بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم أخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم، آمين وأجمعين. اللهم ارزقني نعمة الإخلاص بوجهك الكريم بكل ما أقول وبكل ما أفعل، آمين يا رب العالمين. صوت مسموع؟ Can you hear my voice? Can you hear my voice? Okay, let us start. This is the second spot cases webinar about the body imaging spot cases. I have 50 cases in this webinar, hoping you like it. We start with the first case. This is child. This is child. What do you think of this patient has? This is child. What do you think the patient has? We received some answers, but some of them are wrong, some of them are right. Most of the answers are right. It is a case of pulmonary sling. It is a case of pulmonary sling. It is aberrant left pulmonary artery. Aberrant left pulmonary artery arising from the right pulmonary artery, giving the appearance of indentation on the esophagus anteriorly and indentation on the esophagus posteriorly. So this is a case of pulmonary sling. Next case, this patient has dysphagia and regurgitation. What do you think about this case? What do you think about this case? What do you think about this case? We received some answers. One answer. What do you think about this case? Zinger diverticulum. Someone said it is Zinger diverticulum. No, it is not Zinger diverticulum. Can you think it is another thing? Okay, we receive some answers, and case here, as you see here, this is the diverticulum, but it is anteriorly, so it is not Zinger diverticulum, and it is laterally. So this is a case of Killian-James diverticulum. This is a case of Killian-James diverticulum. Okay, we move to the next case. This case, we move to the next case. What do you think about the next case? What do you think about next case? We received some answers. Okay, very good. This patient has renal infarction, and the sign over here, it is cortical rim sign, as we see here, cortical rim sign, and also the patient has fatty infiltration of the liver. So this is a renal infarction and with cortical rim sign. This is a cortical infarction with cortical rim sign with fatty liver. We move to the next case. Okay. We move to the next case. What do you think about the next case? What do you think about next case is what do you think about next case? We receive some answers. What do you think about next case? We receive some answer. What do you think about this case? It is, we receive one answer, another two answers. What do you think? Okay, as we see here, this is the patient has Crohn's disease, as we see here, involving the terminal ileum with multiple fistulae and cobblestone appearance involving the transverse colon. This patient has Crohn's disease involving the terminal ileum with multiple fistulae, cobblestone appearance involving the transverse colon. So this is a case of Crohn's disease. We move to next case. What do you think about next case is what do you think about next case is what do you think about next case is gallbladder stone, gallstone, pancreatic. Okay. We receive some answer, but it is not complete answers. We receive some answer, but it is not complete answers. The answer of this patient, it is pancreatic divisum, as we see here, and the patient also has the gallstone. So this is a case of pancreatic divisum and gallbladder stone. So this is the answer of this question, this case. Okay, we move to the next case. What do you think about next case? What do you think about the next case? This patient is in unit. What do you think about this case? This patient is in unit. What do you think? We receive some answers. We receive some answers. Okay, very good, all of you. Very good, all of you. This patient has necrotizing enterocolitis, as we see here and we see in the other film, and this patient has necrotizing enterocolitis. Necrotizing enterocolitis. Very good, all of you, for this simple case. We move to the next case. What do you think about next case the patient has? What do you think the next case the patient has? What do you think the patient has next case? We receive some answers. We receive some answer. Someone right, someone wrong. We receive some answers. Okay. We move to the answer. This patient has multiple hepatic cyst, and it is consistent with polycystic liver disease, and it is consistent with polycystic liver disease. This is a case of polycystic liver disease with this is a case of polycystic renal polycystic hepatic disease. Sorry, this is a case of polycystic hepatic disease. Patient has also ascites. Okay, we move to the next case. What do you think about the next case is? What do you think about the next case patient has? What do you think the patient has? What do you think the patient has? Okay. We receive some answers. Very good. We receive some answers. Very good. Answer. All of are right. Most of them are right. We have, this is the patient with sigmoid volvulus, and this is the barium minima, and this is the big sign of the sigmoid volvulus. So this is a barium minima trying to overcome the sigmoid volvulus, but this is the sigmoid volvulus with big sign. This is the sigmoid volvulus with big sign, and here it is a coffee bean sign, and here it is a coffee bean sign. Thanks a lot for answers. Okay, we move to the next case. What do you think about the next case the patient has? What do you think the patient has? Okay, what do you think the patient has? This patient, what do you think the patient has? We receive some answers. Okay, we receive some answer of this case, and as we see here, the patient has xanthogranulomatous pyelonephritis, and we have the sign here. We call it Beerbo sign. So this is a case of xanthogranulomatous pyelonephritis with Beerbo sign. This is a case of xanthogranulomatous pyelonephritis with Beerbo sign. We move to the next case. What do you think about the next case? If you want to receive a certificate for attending this webinar, you can fill the form and write your name and write your email, and you will receive the certificate in a few minutes from submitting the form. So if you want to receive the certificate, please fill the form. Write your name and write your email. As we receive here, this is a very simple case. It is a case of bezoar. So this is a simple case. Thanks all for answering the case. Okay, we move to the next case. Okay, what do you think about next case the patient has? What do you think the patient has next case? What do you think the patient has next case? This is the link for if you want to receive the certificate of attendance. Fill your name and your email in the required fields, and you will receive the certificate within a few minutes. Okay, we receive some answers. Okay, we receive some answers. This patient with aortic aneurysm and extravasation and rupture aortic aneurysm. This patient with rupture aortic aneurysm and active extravasation, as we see here. Here. This patient with rupture aneurysm with active extravasation. So this is the case, rupture aortic aneurysm. We move to the next case. What do you think of the patient has in the next case? What do you think the patient has of the next case? What do you think the patient has? It is simple case. We receive some answers, and the patient has ulcerative colitis with lead by bowel, as we see here. This is the patient with ulcerative colitis with lead by bowel. Ulcerative colitis with lead by bowel or sign. Okay, very good, all of you. We move to the next case. What do you think the patient has? This is next case. What do you think the patient has? What do you think the patient has? What do you think the patient has? This is the new case. What do you think the patient has? Okay, we receive some answers. We receive some answers. As we see here, this patient has left renal mass, and this left patient has left renal mass, and the renal mass, as we see here, this is the renal artery, and we see here the renal vein. Renal vein is involved. So this patient has renal cell carcinoma with renal vein involvement. This is renal cell carcinoma with renal vein involvement. Incidentally, also the patient has renal artery stenosis on the right side with some atherosclerotic changes. So this is the patient has renal artery renal cell carcinoma with involvement of the renal vein and renal artery stenosis on the right side. Okay, this is the answer of our case. Mainly we are looking for left the renal cell carcinoma with involvement of the renal vein and right renal artery stenosis. We move to the next case. What do you think of the next case the patient has? What do you think the patient has next case? What do you think the patient has next case? What do you think the patient has? We received some answer, but the answer are not correct or partially correct. Okay, as we see here in this sagittal reformat image, we have mass involving the uterus, and we have also lymph node in the retroperitoneal area, and this is a case of uterine tumor. Okay, malignant uterine tumor, and as we see here, the dilatation of the endometrial cavity, and the patient incidentally has anterior forward spondylolisthesis of L5 over S1. But the main important things, it is the uterine mass with lymph node. So this is a malignant uterine tumor. This is a malignant uterine tumor in this patient. Okay, we move to the next case. What do you think about next case the patient has? What do you think the patient has in the next case? What do you think the patient has next case? Okay, we received some answers, two answers, one right, one wrong. Okay, we receive, okay, as we see here, we have bilateral angiomyolipoma involving the both kidneys on the right side and the left side. So bilateral angiomyolipoma, if it is bilateral, the diagnosis is tuberous sclerosis. If it is bilateral, the diagnosis is tuberous sclerosis. So bilateral angiomyolipoma, or the diagnosis is tuberous sclerosis. Okay, we move to the next case. What do you think the patient has? This patient has what do you think the patient has? What do you think the patient has? Okay, what do you think the patient has? We receive some answers. We receive some answers. What do you think the patient has? Okay. If you want to receive the certificate, this is the link for the certificate. You fill the required fields, your name and email, and submit the form, and you receive the certificate within few minutes. Okay, this is the link of the certificate. Okay, we receive some answers. Okay, this is the right renal artery, the right hepatic artery arising from the superior mesenteric artery. It is a replaced artery. This is one of the most common variants. Right hepatic artery arising from the superior mesenteric artery. So it accounts about 10%. We move to the next case. This is the right hepatic artery from the superior mesenteric artery. It is replaced. Okay, we move to the next case. What do you think about the next case? Here the link for the certificate if you want to receive the certificate of attendance, and you fill the required fields, your name and your email, and you receive the certificate. Okay, what do you think? What do you think of the next case the patient has? We received 2 answers, right? 3 answers. Okay, we have the answer here. It is uterine histosalpingogram with uterine didelphys uterus, as we see here, two uterine cavities with each speculum and two cervices. Okay, two cervical os separately. Okay, so this is uterine didelphys. Okay, we move to the next case. What do you think of next case the patient has? What do you think the patient has? Okay, we receive some answers and are right. We have this patient has pancreatic mass lesion here and multiple metastases involving the right lobe of the liver as we see in this slide, and possible left adrenal metastasis also. So this is the pancreatic tumor with liver metastasis and possible adrenal metastasis. Okay, we move to the next case. What do you think? It is simple next case. We receive some answers. Okay, very good. Here, as we see here, the barium minima study, and we receive some answers involving the left-sided colon and the sigmoid colon. It is involving the left-sided colon and the sigmoid colon, and this is diverticulosis. So this is a diverticulosis involving the left-sided colon and the sigmoid colon. This is a diverticulosis. We move to the next case. What do you think about the next case the patient has? What do you think the patient has? The patient has, what do you think? What do you think the patient has? This patient? We receive one answer, very good. Siraj. Gallstone areas, Craig, closed loop, gallstone areas. Okay. So we move to the answer in this case, and this is a gallstone areas. As we see here, this is the gallstone, bubble obstruction, and some pneumobilia. Okay, this is the regular triad. Okay, this is the gallstone areas. This is a gallstone areas, and this is very simple, and most of you have answered the case. We move to the next case. What do you think about the next case the patient has? Okay. What do you think the patient has? Cystocele. This is male patient. This is a male patient. This is male patient. What do you think? So this is a male patient, and we have urinary bladder hernia, inguinal hernia, urinary bladder inguinal hernia, indirect one. So this is a urinary bladder hernia, indirect one. So this is a hernia of the bout of the urinary bladder in the inguinal canal. Okay, we move to the next case. We move to the next case. What do you think about the next case the patient has? What do you think the patient has? We receive some answers. Okay, very good. The patient has. Okay, we have some answers here, and this is a necrotizing fasciitis. It is a necrotizing fasciitis. Necrotizing fasciitis. Okay. Oh, we move to the next case. What do you think of the next case patient has? This is simple case. Simple case. What do you think the patient has? Okay, we receive some answers here. Okay, this is the patient has emphysematous cholecystitis, and this is emphysematous cholecystitis. The patient has emphysematous cholecystitis. We move to the next case. What do you think of this female has? What do you think of this patient has? What do you think the patient has? We received some answers. Very good. Dr. Rabia Siraj. Very good. Okay, we received some answers, and here this is an ovarian dermoid. This is ovarian dermoid. We have soft tissue calcification. We have ovarian dermoid on the right side. Very good, all of you, for answering this question. Okay, we move to the next case. This is child. What do you think about this patient has? This is child. What do you think the patient has? Okay, we receive some answers. We receive some answers. Okay, the patient has mid-gut volvulus with malrotation corkscrew sign. This is mid-gut volvulus with malrotation corkscrew sign. This is not pyloric stenosis. Okay. This is mid-gut volvulus with malrotation, and this is a corkscrew sign. Okay. We move to the next case. What do you think the patient has? Okay. If you want to receive the certificate of attendance, here this is the link, and you can fill the required fields with your name and email, and you receive the certificate within a few minutes. Okay, this is, and what do you think about the next case? What do you think about the next case? Okay, we receive one answer. Okay, very good. Okay. So we have this patient with liver laceration from the capsule to the hilum of the liver, and it is grade 3. grade 3. This is grade 3 liver or hepatic laceration, okay, with possible extravasation here, with possible extravasation here, with possible extravasation. So hepatic laceration from the capsule to the hilum and with possible extravasation. Okay. We move to the next case. What the patient has. What do you think the patient has? Okay, we receive some answers, and the answer is superior mesenteric artery syndrome. Superior mesenteric artery syndrome. Superior mesenteric artery syndrome. Conversion syndrome. Superior mesenteric artery conversion syndrome. We move to the next case. What do you think the patient has? Try to fill the form from the computer, not from the uh, from the phone, smartphone. Try to fill the link from the computer, not from the smartphone. Okay, we have next case. What do you think of the next case? Okay, very good. Muhammad Nasser. Very good, Muhammad Nasser. Okay, this is a case of biliary hamartomas. Okay, this is a case of biliary hamartomas and this MRCB. This is a case of biliary hamartoma and this MRCB technique. Okay, we move to the next case. What do you think the patient has? What do you think the patient has? Okay, what do you think the patient has? Okay, what do you think the patient has? The previous case is biliary hamartomas, and the next case is esophagitis. No, candida. Okay, candida or Fellin esophagus. No, it is not Fellin esophagus. Okay, this patient has moniliasis or candidiasis involving the esophagus. Moniliasis or candidiasis involving the esophagus. And we move to the next case. What do you think the patient has? What do you think the patient has? Okay, what do you... Look at this X-ray, and we have two pathology in this X-ray. We have two pathology in this X-ray. Double bubble sign. Okay. We have two pathology in this X-ray. Okay, now we receive some answers. This patient has two pathology, as we see here. We have two double bubble sign due to duodenal atresia, and also we have the NG tube. It is not passing the pharyngeal pouch, this above esophagus, and stuck there, and it is dilated above esophagus, and this is also an esophageal atresia with fistula. So this is duodenal atresia and esophageal fistula with atresia. Okay, move to the... So this is duodenal and esophageal atresia. Duodenal and esophageal atresia. Okay, we move to the next case. What do you think about the next case? What do you think about the next case? What do you think about the next case? أهلا وسهلا بصديقي العزيز خميس الدين. What do you think about this case? Okay. Okay, we need... Okay. As we see here, we have the patient has fecal infection, and this is the rectum, and we have filled with stool with thick wall rectum, and this is fecal infection, and it is some sort of colitis involving the rectum, and this is called stercoral colitis. Stercoral colitis. This is fecal infection causing colitis. Stercoral colitis. Stercoral colitis. So this is stercoral colitis. Okay. أهلا بصديقي العزيز شحاد الشيخ. So this is a case of fecal infection with colitis. Okay, we move to the next case. What do you think about the next case the patient has? Very good, very good, Melham. Very good, Dr. Melham. Very good. So we have some answers, and this is a case of pelvic lipomatosis. This is a case of pelvic or pelvic lipomatosis causing compression of the sigmoid colon and upper part of the rectum. This is pelvic lipomatosis. We move to the next case. What do you think of this patient? Patient 30 years old female, worked for infertility. What do you think about this case? Very good, Dr. Iman Sidawi. So this is a case of endometrioma. This is a case of endometrioma, and we move to the next case. What do you think about next case? Okay. What do you think about next case? What do you think about next case? This is what do you think about next case? What do you think about next case? This is the patient has some problem in the veins. What do you think the patient has? What do you think the patient has? Look at the femoral veins. What do you think the patient has? Okay, what do you think the patient has? What do you think the patient has? Look at the femoral veins. What do you think the patient has? Okay, we move to the next case. This is the patient has femoral vein thrombosis here on the left side, and left side femoral vein thrombosis. Okay, and also some minimal thrombosis in the on the right side. So this is femoral vein thrombosis. Okay, we move to the next case. What do you think the patient has? What do you think the patient has? What do you think the patient has? Very good, Dr. Tariq Dawood. Superior vein thrombosis, very good. Very good, Nis, Ahmad Nis. Okay, Ara Minham, very good. This patient has superior vein thrombosis, as we see here. This is a filling defect, and this is the superior vein thrombosis. Okay, we move to the next case. What do you think the patient has? It is not superior mesenteric artery thrombus. It is a vein thrombus. It is a vein thrombus. It is a vein thrombus, not artery thrombus. Okay. Okay, what do you think the patient has? Patient has very good, Dr. Fatma Muhammad, very good, Shadi Muhammad Hassan. Okay, we have some answers, and this is a case of ulcerative colitis involving the whole of the colon with pseudopolyps and backwash ileitis. This is a case of the ulcerative colitis involving the colon, whole of the colon with pseudopolyps manifested by filling defects and backwash ileitis. We move to the next case. What do you think of the next case? Maybe this is difficult case, the difficult case we have, but you are very good and you will answer the case. Okay. So this is the link again, and Also, this is the link again. To fill the link and try to fill the required fields, and you will receive the certificate in a few minutes, a few moments. Okay, this is the okay, we have some answers and we received the answers. This patient has neurofibromatosis, as we see here, multiple neurofibromatosis in the skin. Okay, and we also have the patient has multiple enhancing tumor involving the small bowel, and these are just the tumors in a patient with the neurofibromatosis type 1. This is just a tumor with the neurofibromatosis type 1. Okay, we move to the next case. What do you think of the next case the patient has? What do you think the patient has? Next case. Okay, very simple case, and you receive it, see it a lot. Okay. Very good. We receive some answers. Okay. Okay, we receive some answers and we will answer. So we have this patient has multiple we have this patient has bilateral papillary necrosis involving both kidneys. This patient has bilateral renal papillary necrosis, okay, involving both kidneys. We move to the next case. What do you think about the next case the patient has? This is the link, Dr. Muhammad Abdul Hamid Nasser. This is the link of the certificate. You can fill your name and email, and you receive the certificate. Try to fill it in the computer rather than the smartphone. Okay, this is the link for the certificate. Okay, what do you think about the next case? Okay, very good, Dr. Rabia. Okay, this is esophageal duplication cyst. Okay, very good. This is an esophageal duplication cyst. Okay, very good. This is an esophageal duplication cyst associated with ascites here and varices. This is a patient with esophageal duplication cyst with ascites and varices. Okay, we move to the next case. Okay, what do you think about the next case? What do you think about the next case? Okay, very good, Dr. Reem, Dr. Tariq Dawood, fill-in esophagus. Okay, this is a fill-in esophagus as we see here. This is a transverse fold involving the esophagus, and this seen in the cats, also in the some of the human being. Okay, this is a fill-in esophagus. We move to the next case. What do you think of the next case the patient has? أهلا وسهلا بالدكتور وسام شمة. عزيزنا الدكتور وسام شمة، أهلا بك. What do you think the patient has? Very good, Dr. Rabia. It is intraperitoneal bladder rupture. Okay, very good. With hematoma here. Okay, this is rupture of the urinary bladder, intraperitoneal with hematoma, and we see this is a cystogram CT scan. Okay, this is intraperitoneal urinary bladder rupture. Okay, we move to the next case. What do you think about next case? What do you think about the next case? Okay, we receive some answer. We need more answer for this case. Okay, we receive some answer. Okay, okay, this is a case of necrotizing pancreatitis with wall of collection. This is a case of pancreatitis, necrotizing pancreatitis with wall of collection. This is according to the Atlanta classification 2012. This is necrotizing pancreatitis with wall of collection. Okay, we move to the next case. What do you think about this next case? This is not a pseudocyst. This is wall of necrosis, wall of collection. This is due to necrotizing pancreatitis. Okay, this is the terminology used with the Atlanta classification 2012. Okay, what do you think about this case? This patient with trauma and the CT scan, okay, very good. This is pregnancy with CT scan. This is a CT in a pregnant patient. This is simple. This is a CT in pregnant patient. This is a CT in a pregnant patient. This patient come for trauma and they did for his CT scan and she is pregnant, and this is the baby in her uterus as you see here. Okay, and we move to the next case. What do you think about the next case? What do you think about the next case? Okay, very good. Dr. Amani Nabil, splenic cyst, and Tariq Dawood, it is splenic cyst. Very good, both of you. Okay, splenic cyst. Okay, this is a splenic cyst. As we see here, this is a splenic cyst involving the spleen. Okay, this is coronary format image. Okay, this is a splenic cyst. Okay, we move to the next case. What do you think about the next case the patient has? What do you think the patient has? What do you think the patient has? Calcified urinary bladder? No, not calcified urinary bladder, not schistosomiasis. Okay, okay. Calcified uterine mass, very good. Okay, so we have this patient. As we see here, this is the urinary bladder. This is the urinary bladder. It is compressed, and this is calcified uterine fibroid. This is a calcified uterine fibroid, and this is a calcified uterine fibroid, and this is the urinary bladder. Okay, very good. And the patient incidentally has two renal arteries supplying the left kidney. Okay. Moving to the next case, what do you think the patient has? as I send the link again for who are not filling the form of receiving the certificate, and you can uh, fill your name and email and you receive the certificate if you want. What do you think about uh, what do you think about the next case? Okay, bilateral. Okay, we have this patient has bilateral ureterosis. Bilateral ureterosis. The left one is larger than the right one, and this is the cobra head sign. Cobra head sign. Bilateral ureterosis. And we move to the next case. What do you think about the next case? 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 Again, this is the link for the certificate if you want to receive it. Okay, this is we receive one answer now. Very good, Dr. Siraj. Okay, cholelithiasis. Okay, common bile duct stones, ERCB with common bile duct stones, ERCB. Okay, this patient has, this is a ERCB. We have multiple stones in the common bile duct and also multiple stones in the gallbladder. So this is a cholelithiasis and decolithiasis. So this is both stones in the gallbladder and the common bile duct. So we move to the next case. What do you think this next case in this child? Okay, what do you think of this next case? This patient has, this is child, as you see the catheter here. Okay, we receive this case. This is the vesico-ureteric reflux, grade 5. This is grade 5 reflux, as we see here, the urinary bladder, tortuous dilated ureter and pelvic calyceal system. This is grade 5 vesico-ureteric reflux. Okay, we move to the next case. What do you think about the next case is? What do you think about next case patient has? Okay, we received some answers, and this is large urinary bladder stone, large laminated urinary bladder stone, large laminated urinary bladder stones, large laminated urinary bladder stone. We move to the next case. What do you think about the next case is what do you think about the next patient has very good, Dr. Tariq Dawood, porcelain gallbladder. Okay, this patient has porcelain gallbladder. This is the patient has porcelain gallbladder, and we see with the stone we have West sign, and this is there is no West sign here. This is porcelain gallbladder. So this is porcelain gallbladder, and we move to the next case. And this is the next case. What do you think about the next case? What do you think about the next case? History: this patient is on dialysis. This patient is on dialysis. What do you think the patient has? What do you think the patient has? This patient on dialysis. What do you think the patient has? Pelvic hematoma? No, it is not pelvic hematoma. Not Burton. Okay, what do you think the patient has? Patient on dialysis. What do you think the patient has? Okay, calcified. Okay, there's calcification. Very good. There is a calcification. What we call this calcification in the peritoneum? We call it encapsulated peritoneal sclerosis or sclerosing encapsulated peritonitis. Okay, we call it encapsulated peritoneal sclerosis, and also known as sclerosing encapsulated peritonitis. So, and this is looks like a cocoon. It is looks like a cocoon, and sharnaqa. It is looks like a cocoon, and sometimes the patient presented with obstruction. Okay, this is due to calcification following one of the complications of the dialysis. Okay, and this is called encapsulated peritoneal sclerosis or sclerosing encapsulated peritonitis. This is the last case. سبحانك اللهم وبحمدك أستغفرك وأتوب إليك. Okay. Uh, for those who not fill the form for to receive the certificate, this is the link again, and you can fill the form, and you receive the certificate. And next time we have the musculoskeletal spot cases, musculoskeletal imaging spot cases, and we have about 50 cases, and all of them are adult. All of them are adult patient and musculoskeletal patient. All of them are adult patient. And in the pediatric musculoskeletal, in the pediatric spot cases, we bought the musculoskeletal cases in the pediatric. And this is the last time we have the certificate. We have the link for certificate. Hoping to fill the certificate link and see you, and you receive the certificate. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك. Thank you all for attending the webinar, and see you soon in the musculoskeletal spot cases, inshallah. Thank you very much, and good night all of you. تصبحون على خير إن شاء الله.